Imagine walking into a new doctor's office and instead of being handed multiple forms to fill out, the receptionist glances at her computer, greets you by name, and informs you that the doctor will be right with you. Far-fetched? Not really, thanks to a remarkable new technology.
Proxmed is based on TrueProx, which is Proxense's proprietary proximity technology. And TrueProx at its simplest is really just two components: personal digital keys, PDKs, and sensors. And the PDKs are little devices that a patient or a doctor can carry in their pocket, and they're capable of holding a patient's core medical data and other types of data for doctors.
EMR, or electronic medical records, are not a new idea. The healthcare industry recognizes the advantage of implementing EMR, however, privacy and security have always been an issue. The proximity device addresses both concerns.
To retrieve data from a patient's PDK, either the patient or the provider needs to swipe their finger on one of our biometric sensors. Once the authentication is completed, then the PDK and the sensor communicate securely and allow the data from the PDK to be transferred back to the sensor, back into the EMR system. The technology itself is far surpassing HIPAA, and yet it's extremely simple and quick and efficient to use.
Safe and secure electronic medical records improve the healthcare system on many levels, primarily in the coordination of care. Redundant tests are avoided, and every member of a patient's diagnostic and treatment team has immediate access to the most up-to-date case history.
I think the greatest advantage of electronic medical records is it allows me to spend more time with my patients. It's very common for patients to show up in the office and they've had some type of scan done at an outside hospital, and we don't have access to that. Therefore, we cannot provide any treatment to that patient until we get access to their MRIs or CT scans. So it speeds up care. It allows us to move to the next step much quicker.
It's estimated that by 2030, there will be over 70 million older Americans in need of care, creating a strain on an already overtaxed healthcare industry. More patients means more paperwork, and every minute that a doctor spends on paperwork is a minute less that he can devote to his patients.
Whether in the clinic or hospital, I used to spend more time looking for the charts rather than taking care of patients. Now with electronic medical records, I spend much less time doing that and can really focus my whole attention on the patient. And when I can do that, I can deliver better care.
The healthcare industry also believes that accurate and secure electronic medical records can significantly reduce potentially tragic medical errors.
As we see more and more adoption and usage of electronic medical records, and specifically having up-to-date core medical information on a patient at all times, it will prevent errors.
When taking care of sick, complex patients, things can change very rapidly. It's very important to have accurate, timely information. With Proxmed, we can get that data quickly in real time, and that may be the difference between life and death.
In a hospital setting, this technology not only reduces paper use and consumption, but can also be used to efficiently track a patient's movement within the hospital, as well as track high-value medical equipment.
Healthcare organizations struggle on an ongoing basis moving patients, support staff, and equipment throughout the facility. With a proximity device, you can rely on the fact that you will know where your resources are, where your patients are, and where the support staff are on a minute-by-minute basis, and thereby deliver healthcare in the most cost-efficient manner possible.
The major change we see coming in EMR systems is where data is stored. Currently, it's just scattered across all the different doctor's offices the patient's ever visited. Long term, we see it being stored on a very secure, centrally accessible file server, meaning that it's accessible to both the providers and the patients anywhere in the world.
Are you a medical practitioner or hospital administrator looking to improve the efficiency of your operation? How would you like to document patient encounters quickly and have data flow efficiently to the right people throughout your office or facility? How would you like a patient's entire medical history to show up as they reach the receptionist's window? You can with Proxmed.
Proxmed is based on TrueProx, and TrueProx at its simplest consists of two basic components: personal digital keys, we call them PDKs, and sensors that can detect and communicate with those keys. For providers, Proxmed offers a full suite of applications. It includes automatic log-in, log-out, automatic patient registration, integrated telemetry and location tracking, and they all run on one unified infrastructure. Proxmed also allows providers to integrate numerous what are currently standalone systems, and it provides very powerful EMR to EMR data exchange capabilities.
Proxmed's unique proximity technology is unlike any other electronic medical record solution available. The proprietary proximity technology makes integration simple, with little or no learning curve for doctors and staff. Sophisticated biometrics ensures privacy, and with the burden of paperwork almost eliminated, practitioners can devote more time to patient care.
When a patient enters my exam room, the chart will automatically upload. When I enter, I'll have access immediately without ever having to log in. And when I walk away, it'll log me out. At the end of each visit, the auto-synchronization tool will automate the process of updating and saving their medical information.
A fundamental element of Proxmed is its patient's record model. And in this model, the complete records for a patient are maintained on a centrally accessible server, but the core data, the data you typically have to fill out every time you go to a doctor's office, is stored in the patient's PDK.
I'm really excited about this new technology because it means I don't have to fill out forms every time I go to a doctor's office. I think it's going to save a lot of time, and I don't have to remember all my history and medications, and it's going to be great.
Being based on TrueProx, any PDK can be used for any other uses that Proxense has defined. This includes using it to replace your credit card and bank cards, to replace passwords and PINs, and to replace even the keys to your house potentially. A PDK really can become your wallet, your ID, your keys, and your mobile data vault.
The future of healthcare is here today. Proxmed saves time, saves money, and saves lives by putting patient information at your fingertips. For more information, log on to proxense.com.